Hello everyone, we are group 13 and today we are going to be presenting to you about tuberculosis. My name is Lucy Hoffman.
My name is Tanya Desjardins.
I'm Alexa Dragon.
I'm Angelica Molina.
I'm Mackenzie Willis.
All right, so first off, I'm going to kick us off with a little case study. Here we have Sarah. She travels a lot for work, and for this trip, she went all the way to Indonesia. She had a great time, but a few years later, she did develop type 2 diabetes. Sad face. Shortly after, she did start to feel very ill. She went to the doctor because her symptoms included a cough for over a week, loss of appetite and weight loss, fever, chills, and night sweats. The doctor did have a hunch, so he tested her, and she tested positive for tuberculosis.
For the background and history, we have that tuberculosis is or pulmonary tuberculosis. It's originated in East Africa, caused by the bacteria Mycobacterium tuberculosis. Also, you can call it bacilli tubercle. It's an infectious disease that is spread by cough, sneezing, droplets that can infect healthy host that can cut it through the air, and it can attack the lungs and other part of the body like the kidney and the liver. And the bacteria has waxy walls and it's slow to grow. It's latent, dormant. It can be, someone can have that bacteria grows like pretty slow and show no symptoms. And it's the bacteria codes for like enzymes that will produce lipids that will be that will make it impossible for the human system to recognize those bacteria and do nothing about it. And first, it was isolated by Robert Koch.
So some of the common symptoms presented in patients with TB, or even as it was presented in our case study, would be fever, chills, night sweats, feelings of weakness or fatigue, a cough lasting for more than 3 weeks, a loss of appetite, or unintentional weight loss. Some other patients can also experience coughing up blood or phlegm, just like that really thick mucus coming up from like the lower respiratory tract, and even chest pains. And those would be a sign of TB in the lungs. Other patients can also experience pains in the bones or aching in the bones as well, and that could mean that the bacteria has invaded their bones.
The incidence rate worldwide for 2019 was that there was 1.4 million dead. It's one of the top 10 cases of death worldwide, 10 million infected, and 1.2 million children infected. The incidence rates for tuberculosis in the United States is at its lowest. And why is this? That's because the United States has higher funding. They focus on preventing and detecting tuberculosis early on. The lowest number of cases was approximately 8,900 in 2019. We had the lowest incident rates at 2.7 cases per 100,000. And those who had tuberculosis in the US, 71.4% of those were born outside of the United States. And so why do most of US citizens that have tuberculosis born outside of the United States? It's probably because they contracted it before coming over and they had the latent tuberculosis infection.
Okay, next we're going to be going over the risk factors. I do have this separated into latent TB as well as active TB. Latent TB is the actual physical bacteria entering your body. The most high chance of, or when you first get infected, you're most likely going to be latent TB. And you can contract this bacteria by being in close contact with infected people with active TB. You can migrate from areas with high active TB rates. Also, if you're part of a group with a high TB transmission rate, including homeless, communities, injection drug users, patients with HIV, and also being a part of a group in a healthcare or group care facility, such as hospitals, homeless shelters, etc. Next is going to be active tuberculosis, which is going to be latent tuberculosis actually affecting your immune system and showing symptoms. And this is mainly triggered by the weakening of the immune system. So some of the most high-risk conditions that can cause latent TB to become active TB include HIV, substance abuse, diabetes, kidney disease, low body weight, head and neck cancer, corticosteroid or organ transplant treatments, which is basically just steroid treatments for inflammation, as well as silicosis.
All right, now for the physiology and pathophysiology. As we talked about before, the scientific name is Mycobacterium tuberculosis bacilli. It is a small, slow-growing aerobic bacilli, which means that it needs oxygen to grow. Depending on which 3 stages you're in is how it's going to affect the body. For primary infection, the droplets, if they're small, then they'll cross through the upper respiratory defenses. And once this happens, it'll travel deep into the lungs. If it's a larger droplet, however, chances of it making deeper into the lungs is very slim, so it won't cause infection. Normally, it takes only a single droplet nucleus that's carrying a few organisms to get into the lungs to start causing the symptoms and infection. If an individual is immunocompromised, that single droplet can be enough to cause a reaction. However, if the individual does have a stronger immune system, then they normally are fine. Once the bacteria gets in, it must be ingested by the alveolar macrophages. The bacteria is not killed by the bacteria that is not killed by the macrophages will actually begin to replicate inside them and will eventually kill the host. When that happens, the inflammatory cells attack that area, and that's what can cause the associated symptoms with TB. Moreover, in the early weeks of ingesting TB bacteria, the infected macrophages can travel to other parts of the body through lymph to get to the bloodstream, and that's how people can get it in their bones. For latent infection, this occurs after primary infections. The body can normally fight it off if it's not a severe infection, so the virus can stay suppressed, or the bacteria can stay suppressed within the body for a really long time until the individual does develop some sort of disease, which is what takes us into the active infection. So when the active infection happens, that means that the individual did develop another disease such as type 2 diabetes that we talked about in our case study, or HIV that we also talked about. Once that does happen, severe symptoms can occur such as necrosis, lesion, and erosion of the lungs.
For diagnosing tuberculosis, there is a way that you can see if you were introduced to the bacteria. You can test for infection with the TB skin test, a TB blood test, but this only tells that the patient has been infected. It doesn't tell if they have latent TB or TB disease. To actually diagnose, you need something like a chest x-ray or a sputum sample. With latent TB, doctors can start treating for it if the patient has a positive TB test but not showing any signs and symptoms, and treatment depends on risk factors. So if someone tested positive for a TB test, and they also have diabetes, then they would start treatment right away. To be diagnosed with TB disease usually comes with medical history, physical exam, chest x-ray, and a sputum smear. And the sputum smear takes a little while to get back so they can start treatment before they get the positive results from that. It's just used to confirm. The chest x-rays can be used to check for lesions in the lungs. And the limitations with the sputum smear is that the countries most at risk that carry 95% of tuberculosis cases only use the sputum smear as a diagnosis, which takes a long time to get back and it delays treatment.
Some of the most common treatments and therapies for a patient with active or latent TB would just be a combination of various medications. Some of the first in line of those medications being isoniazid, rifampin, or also called rifidin, remactane, ethambutyl, or also called myambutyl, and pyrazinamide. It's really imperative that the patient with tuberculosis they do take the medications as prescribed and for the entire length of time that they're supposed to take them for. Otherwise, the TB bacteria can become resistant or come back too soon. And I'm sure that it's very tough because they are taken over several months, about 6 to 9 months, that these medications have to be taken. For latent TB, for patients who have that, it's about the same amount of medications, same combination, but instead of rifampin, they could do rifapentine. However, if the patient does develop drug-resistant TB, a combination of antibiotics, also called fluoroquinolones, and other injectable medications such as amikacin or capreomycin, are generally used for about 20 to 30 months. So a very long time to fight off the drug-resistant TB. And on top of the combination of the medication, some other drugs to counteract the drug resistance would be bedaquiline and linezolid.
For the prognosis part, can be many prognosis, but I have two of them that kind of like more important. We have like the cure stage and the incure stage. These can be altered by whether or not the person is a smoker, if they consume alcohol on a daily basis, if they have AIDS or HIV. This can determine if they can continue the treatment and if that will help them have a higher chance to survive. And we have tuberculosis, if treated early, if there's less damage to the lungs, the person can have a better response to the drugs. And yeah, and it's considered non-virulent and it's at the acute stage. And if the person is not treated early and if the lungs was damaged before the treatments, the bacteria could resist to the drugs and the treatments and will have the virulent stage and it's considered chronic and the person will most likely die.
Okay, so lastly, we're going to finish out with some extra information about TB. So firstly, there's just a 5 to 10 chance of latent TB becoming active. I guess this also means that you have a 5 to 10% chance of getting immunocompromised and having that come up. TB is so dangerous today because that latent phase can last years to decades since you don't show any symptoms until your immune system is suppressed. There's an estimated 2 billion people worldwide who have latent tuberculosis, and 13 million of those people are in the US. And then this TB is only becoming stronger against drugs as it evolves because the latency period allows for the bacterial evolution or is one of the contributing factors. Because of the unique latent phase of TB, there's currently no vaccine available for this disease, despite research beginning in 1890, actually by Robert Koch, who was referenced earlier in this presentation. And there's also a list on the CDC website of the 30 high burden countries where where TB is most prevalent, and most of those are in Africa and South Asian countries, and they're predominantly third world countries.
All right, thank you for enjoying our presentation. I hope you have a great day.
How long was